Hi Laura, thanks so much for
Hello.
joining us on Britain's Birth Stories podcast.
It's very exciting.
Would you love to tell us where you're based and who is in your family?
Yes, so as you can probably tell from my accent, I'm in the northeast. Live in South Tyneside, born and bred northeast. We are a family of four, so there's myself, my husband Joe, and two children. We've got Lucas, who is 5, and Iris, who just turned 1 in October.
Oh, amazing. And would you mind sharing what's your profession at the moment, apart from taking care of yourself and family?
So I work for a distillery. I work for Durham Distillery, so we make gin, vodka, lots of nice things. Very, very varied and interesting job. I actually really love it, and I'm very fortunate because it's really flexible. So I have 3 days that I work, but if I need to change them or I need to finish early, start late, swap, whatever, it's not an issue, and so it fits really nicely, and it helps that it's something I really enjoy doing as well.
That's great.
It's nice to talk to people about gin. Let's be honest, everybody wants to talk to you when you tell them that you work with alcohol.
Well, exactly. You've got it all, haven't you, at this point? Right, thanks so much for sharing that, and let's go into your pregnancy with Lucas. Was this something that you'd thought of, or did it just happen?
No, it was planned. We had gotten married in July, and had always kind of thought we probably wouldn't wait that long. We knew we wanted children, and when it was around about the Christmas time, we did, I think, what a lot of people do, and just sort of said, "Oh, we'll just see what happens." And then in February time, when was it? Let's have a look. Yeah, so it was sort of end of January. Found out I was pregnant, so I was very, very lucky that it happened so quickly, because I have a lot of friends who have struggled, and it was a bit of a shock, actually. I think I was sort of, you see that positive result, and at the time, I had no symptoms or anything. I wasn't feeling sickly or bloated or anything, and I was like, is this real? Is this happened? So I did, again, what I think a lot of people do, and I must have taken about 6 tests. Different brands, different coloured dye, or, all of it. And, still was coming back positive every single time. And I think it's a really odd thing when you first find out that you're pregnant, because it's this massive piece of news to you.
Yeah.
But nothing happens. You ring your doctor, and your doctor tells you to book in with your midwife, and your midwife says, "Yeah, I'll see you in a few weeks' time." And you're like, "Oh, okay. What do I do now?"
Yeah.
So we were thrilled. We were really happy, and it was first grandchild on both sides. So, but it was. I think we were both just genuinely shocked that it happened so fast. And then obviously, as time goes on, and you start to get a bit of a bump and things like that, it starts to feel a bit more real. You have your first scan and things like that. But yeah, ultimately it was just shock. That was the overriding emotion, I think.
Yeah. Well, definitely, especially since it's first grandchild on both sides, that there's sort of, what I can imagine is not underlying pressure, but that underlying expectation of just something that's so amazing all the time.
Yeah, exactly.
Exactly. And how was the pregnancy overall for you?
I was very lucky. I had a really straightforward pregnancy. No issues with anything like blood pressure or iron levels, or a lot of the sort of typical things you would get. Around about, I probably would have been maybe 6 or 7 months pregnant. There was a slight discrepancy with measurements, where the first set of measurements had been done by the community midwife, the second set had been done by a student, and the third set was done by the normal community midwife, and there was a bit of a discrepancy. So it referred us for a growth scan, which came back absolutely normal, which they thought it would, but it was, something that it's so easy to check, was kind of the attitude towards it, that let's just send you. I am quite tall as well, and it's something I've found since I've had kids, that a lot of my friends who are tall have the same issue, because you've got a longer torso. I think it's more difficult to get that bump measurement, because there's obviously more space for baby to spread out and stuff. So I did have a growth scan at about, I want to say 7.5 months pregnant, but as I said, it was totally normal. And I had a little bit of pelvic pain, but that was quite late on, really. I didn't struggle with it all the way through or anything like that. But really, to be honest, quite a textbook pregnancy. I was very, very lucky. A little bit during the beginning, I used to find when I first woke up, I felt a little bit sick, but I never really actually threw up. And the thing that used to make me feel the worst was brushing my teeth, which obviously is a bit of a nightmare. So I used to just have to sort of hold my breath, brush my teeth, and hope that was okay. But that again passed by about 12 or 14 weeks that had gone. So I was very lucky.
Amazing. And had you thought about how and where you'd like to give birth at this point?
I always had a bit of a vague idea. I'm quite, I was always fascinated by it. I would always talk to friends, family, who had babies. I was really interested in it long before I'd ever thought about having kids. And in South Tyneside, we're quite lucky. So I had the choice of the QA hospital, which is near us, South Tyneside Hospital, and the RVI in Newcastle. And at the time, and I don't know that I've ever seen this since, and everybody I've spoken to about it has this blank look on their face when I tell them, but there was a website that you could use where you basically filled in information about you, what your preferences were, how you felt about pain relief, all these sorts of things, and it would rank the facilities in your area against what your preferences were. So the top result actually was a standalone midwife unit, and we weren't quite brave enough to think that was for us. But the RVI seemed like a perfect option because, as well as having a birthing centre, it also has just on another floor a fully equipped, delivery suite and everything. So if you do have to transfer or whatever, you're just going up in a lift. You're not having, I've had friends who've had to transfer mid-labour in ambulances and things like that, and that just didn't. I didn't want to get into that. My hope was that I'd have a really straightforward birth. I really, really wanted water. I love being in the bath, and I just thought this sounds like a perfect fit for me. So really, really wanted to be in the water, at least for some of it. Whether or not I actually had the baby in the water, I wasn't too fussed about, but that was sort of my aim. And in terms of pain relief, hope that I could kind of go without, but I didn't have any strong feelings, so I was very much of the mindset that if I'd had I got to the hospital, was in labour, got in the water, got the gas in there, and that just wasn't cutting it. Wasn't above going, you know what, I need something more, can we transfer upstairs and have an epidural, because I've never done it before, and really I've never had any way of testing my pain threshold, if you know what I mean. I've not broken a bone, I've not done things like that. So I didn't know, I could get into labour and think this is the most horrendous thing that's ever happened to us, and I absolutely can't cope for a second more. So I kind of went in, I had this vague idea, but I was open-minded, and the hospital that we chose seemed to be the best one to cover as many options as possible.
Right.
The midwife that I had actually was very, very supportive of a home birth, which again I'd heard from friends that live in different parts of the northeast they hadn't had, but when I explained why we chosen the RVI and what I was looking for, she was actually, I was 29 at the time. I didn't have any, complexities with the pregnancy. She was like, there's no reason why you couldn't try for home birth, that would be absolutely fine. And I just wasn't quite brave enough for that.
Right. No,
but it was nice to know that option was there, that it was supported, and it wasn't sort of you can do it if you want, or it was quite open and keen about it. So as I said, we didn't go for that because we weren't quite that brave, but it was nice to know that option was there.
Yeah, definitely. It's nice to hear also that you were informed about it. It wasn't just something that was left until you asked.
Yeah, and I think because when we were discussing, why I chose to be booked at the RVI, and, to be honest, I never even really seriously considered a home birth. So I'm sure there are people that, knowing that the midwife was supportive and stuff, might have felt that bit braver to do it.
Yeah.
And as I said, I know I have got friends in other parts of both in the country and just in the northeast who've said that they haven't had that support, and it's a shame. Because I think that some of them do feel like they missed out a bit. So I was really pleased with that. You know, as I say, she wanted to make sure I knew what all of my options were, and that I hadn't, you know, ruled anything out, sort of thing.
Amazing. That's great to hear. And in terms of your labour, how did that begin and progress for you?
So I'd been due to finish work at 38 weeks, and it got to the Wednesday of that week, and I'd had enough, I think, if I'm honest.
Yeah.
I was so tired, and I just went in to our manager and I was like, I just can't do this anymore. And she's like, that's fine, don't worry about it. And I was like, I'll come in, this is the Tuesday, I'll come in tomorrow, finish off all the bits I need to finish, and then I think I need to take an extra couple of days leave. And she's like, no problem. So I finished work on the Wednesday, and you know, everybody tells you your first baby will go over. So I was trying to work as late as possible so that I could have as long as possible off after with the baby.
Yeah.
And I had some bits and pieces I needed to do, but I had loads of time. So I finished on a Wednesday, and we had my in-laws visiting that weekend because it was Great North Run weekend.
Wonderful.
So they came to stay, and we normally we live near the halfway point, so we normally go to the halfway point and things, and I didn't bother that year. And then the following week, I did all the typical, you know, I did some final stuff with the hospital bag and all that kind of thing. Still thinking I probably had at least a week or two, at least. And I think I'd seen the midwife at 38 weeks on the Tuesday.
Yeah.
And she said, okay, well, I'll see you on your due date then. I was like, yeah, okay, fine. And then what had been happening was my husband had been going into work early in the morning, so he was trying to get in at like super, super early in case anything happened during the course of the day, and to try and get ahead of stuff knowing he was going to be off at some point soon. Yeah. So he was actually leaving the house at about, must have been about 7:20, 7:30 in the morning. And I woke up and I'd been tossing and turning, and I thought, I'm going to get up, I'm going to go to the loo. And then sometimes that sort of getting out of bed, getting back into bed, and I might get another hour or so. And I got up and I took about 5 steps from our bed to our ensuite door, and my waters broke.
Oh, wow.
And it was, you know, in the antenatal classes, we'd covered all of it. It might not be like it is in the films. It might be, you know, a trickle. It might be this. It might be... This was a full-on, like the floor was soaked. I'm pleased that we didn't have carpets down. I'm pleased it was like wooden flooring. And I just sort of stood and shouted, and he was like, yeah, and I went, I think my waters have just broke. I mean, I don't know why I said I think. There was nothing else that it could have been.
Yeah.
But at that time, again, because I was just surprised, because everybody tells you, you know, you're going to go overdue with your first baby. So he came upstairs, found me in the ensuite, and I was like, can you get towels? Can you know? And luckily, the water was clear, so there was nothing really to be concerned about. So I rang the birthing centre, told them I was 38 weeks. My waters had gone. Was I sure it was my waters? Yes, I was as certain as I probably could be that it was my waters, but they were clear and it was fine. And she said, okay, are you having any contractions? And I was not having a hint of a contraction, nothing. Yeah. So she said, they might start, yes, now your waters have gone, but you need to come in for us to check. There's no great rush, don't worry about it. You know, if your waters are clear and you feel fine, you know, there's nothing, it doesn't need to be, you don't need to rush into the car immediately, but,
right,
you know, get yourself ready and bring yourself in, sort of thing. So at this point I rang my mum. She was coming to be with us as well. So she drove through. We all trooped off to the hospital and checked. Yes, it was definitely my waters, but you know, nothing was happening. I wasn't dilated. Baby's head was still relatively high. Yeah. Nothing was happening. So she said, you know, you can go home, do as much as you can, you know, get on your birth and ball, try and walk up and down the stairs, try and, you know, just encourage things along. But I think your waters have probably gone because your baby, although he was head down, I didn't know he was a boy at that point. We didn't find out. Although he was head down, his back wasn't at the front or the back, he was on the side.
Right.
And she said, I think he's just in a funny position. I think baby's just in a funny position as you've stood up. That's why your waters have gone, because you've been lying down, you've stood up, and, you know, the weight's settled, and that's why. So I suspect that not much might happen, but go and try. And in the meantime, we'll book you in for induction.
Right.
I can't remember how many hours it was going to be, but it was going to work out to be like 2 o'clock in the morning or something. So she said, you know, we'll be here. Doesn't make any difference to us, but would you rather come in at like 10, 11 o'clock? A bit more, you know. And I was like, yeah, let's do that. So came home, and it was a very odd day because, again, a bit like when you find out that you're pregnant, you know what's happening. You know, we rang Joe's parents, my husband's parents, they lived in Manchester at the time, and said, it's going to be, you know, my waters have gone now, you're sort of on a bit of a clock.
Yeah.
But I don't know if it's going to be today, it could be Monday, it could be, we don't know. So you don't need to jump in the car and rush up, but, you know, sort of start making your plans. And didn't tell anybody else that that my waters have gone or anything. So we potted on, we did some things in the house, all the time, on my birth and ball, up and down the stairs, nothing was happening. And then it got to around tea time, and when I'd gone in, they said obviously there is a higher risk of infection now that the waters have been broken. So what we want you to do is every 2 hours, I think it was, or it might have been a little bit longer than that, I had to take my temperature with a disposable temperature strip.
Right.
And they said if your temperature creeps up, you need to contact us because we'll want to get you in straight away.
Yeah.
And obviously reiterated that your movements, the baby's movements, should carry on as normal. And he'd been very active throughout the whole pregnancy. He'd been, you know, a lot of movement, a lot of big movement, pretty much all times of the day. So it got to probably about 5 o'clock, 6 o'clock, and I still to this day don't know if this was psychological or if he had slowed his movements a bit, but I was like, this just is, I don't know. So, of course, we rang them and they said, you know, no doubt about it, just come in and we best check. And we were kind of prepared that if I was going in then I probably wasn't coming back home because, you know, I was going in to be induced at like 10, 11 o'clock anyway. So we went in, put me on the monitor, checked his movements. Of course, he was absolutely fine. Moving about loads by the time we got to the hospital. And she did say, you know, it could be just that you're feeling them differently because there's less fluid now. On all of these things you don't really think about in advance. That obviously, you know, you've had this massive bag of waters and all of a sudden the majority of that's gone. So the movements maybe do feel different. So then she said, you know, it's like by the time I'd gotten in, they'd had us on the monitor for an hour and stuff. It was about 8:30, 9:15, and she said, I don't know if you just want to go and have a wander and a coffee, and then come back at, I think it was 10 o'clock I was coming back. So we said, yeah, but, you know, we're not going to drive home to drive back. So went away, came back, sat around for a while, and then she said, okay, I'm going to do an examination. And if I'm honest, obviously you'll hear more about what happened with later on and stuff.
Yeah.
That examination was probably the worst part of giving birth to me.
Oh, God.
Genuinely. It was. I mean, and she did say, I'm really sorry, this might be uncomfortable. And they inserted the pessary. And she said, the thing is, because, you know, your cervix is not dilated, it's not softened or anything, it will be quite uncomfortable, and I'm really sorry. But she did at least, you know, she tried her best, is what I'm trying to say. That, you know, and I think I felt a bit better knowing that she knew that I wasn't being dramatic. That's probably not the sort of thing I should say, really, because it's not being dramatic if it's painful, but that was genuinely one of the worst parts of having a baby. So she popped that in and said, we're kind of just leave you now, basically. I was in a room, there were other beds in the room, but there was nobody else else happened to be in. So
right.
I think it was 2 or 3 beds, but I was the only person in. So Joe and my mum came home, and they said, obviously, if anything happens, we'll ring you, but, you know. And there I was, and there I stayed. Nothing. And maybe the odd Braxton Hicks type contraction, but nothing of any significance that I noticed.
Right.
Didn't really sleep. You know, you're trying your absolute best to get some sleep because everybody tells you to get rest, and you can't. You're not in your own bed, and, you know.
Mm-hmm.
Oh, yes, and by this point I had the super sexy surgical stockings on as well.
Yeah.
Which were a highlight. I don't think until you've ever had them on you realise exactly how tight they are. And getting this poor nurse trying to get them on to me at like 9 months pregnant. As I say, I'm not a small, like I'm 5'8", so I've got quite long legs. So they came around about 7 o'clock the next morning, and honestly, I was dreading them saying, we need to examine you, because of how painful it had been the night before.
Yeah.
And she said, so is there anything happening? I mean, I'm guessing not, because you haven't buzzed us or anything. And I said, nothing, not a thing. And she said, all right, okay, I'm not going to bother putting you through an examination. And the relief that brought, because I've heard so many horror stories about people being like, not forced into having examinations they didn't want, but feeling like they didn't really have a choice, that there wasn't really another option. And I just immediately, I was like, oh God, I feel so much better, you know. And she said, no, you know, based on what it was a different midwife to the one night before, based on what she's written in your notes, and what you're telling me, there's no point in doing it just for the sake of doing it. And I was like, oh, right, okay, I feel much better. And she said, so normally what we would do at this point is we give you a second pessary. Mm-hmm. But your waters have been gone quite a while now, and to be honest, by this point it was a Saturday. She said, we might get busy later, so we're not going to bother, and if you're all right, we're just going to put you straight on the what's it called, the
drip. Yeah, the drip, yeah,
the hormone drip. And I said, yeah, that's fine by me, because again, thinking, don't want to have to go through having another pessary, and that was horrendous, and it didn't even do anything. Mm-hmm. So with hindsight, we don't now know if actually maybe it might have done more than we realised, but you'll probably understand a bit more about that in a minute. So it's about 7:30 by this point. My mum and my husband come back. I meet my midwife. She comes to put the cannula in, and again, that was one of the things I was most nervous about. Mm-hmm. I wasn't nervous. This is ridiculous, I know, but I wasn't nervous about giving birth. But having the cannula put in really sort of freaked us out. Yeah. Mm-hmm. And then said, you know, we'll put you on whatever, I can't remember what the dosage was, but basically we put it on, we leave you for half an hour, nothing's happening, we double it. We'll leave you for half an hour, nothing's happening, we double it. And I was like, okay. And that just keeps going until something happens. She said, pretty much. And if nothing happens, then we take a view on what else we need to do. Okay. And I was like, right, okay. So I read and I had all these intentions of like, even if I ended up upstairs in the delivery suite with an induction or something, because obviously my dreams of being in the birthing centre and water and stuff, that was gone. Mm-hmm. But I thought, you know, there's a shower in the room, so that could be, you know, a warm shower on your back, and I'll get up and I'll move around, and not to, you know, spoiler alert, that never happened. Right. So she put the drip on. Probably by the time everything got sorted, we were at maybe 8 o'clock, 8:15. Mm-hmm. And not a thing happened. Nothing. Right. We watched some television. I was desperate for something to eat, but she said I couldn't really have anything, so we negotiated a packet of Belvita biscuits. That was the compromise. Okay. And then kept coming in, up in the dosage. Then at about 10:30, I was like, oh, I think this might be, I think that's doing something now. So she came in and she looked at the monitor and she went, yeah, she felt me stomach, and she's like, yeah, they feel like, I think something's happening. And I was like, oh, okay. And then they kind of just got to a point where I was like, oh, they're definitely contractions, yeah. Right. But I very much felt like that about it, not, oh, this really hurts. I was just like, oh, yeah, that's definitely what people describe. Yes, I feel like we're going somewhere now, yeah. Mm-hmm. Mm-hmm. But then at 11:30, I'm like, I think I might need some gas and air because I think it's getting a bit ouchy. And she's like, yeah, no problem. In the meantime, I'd got up and gone to the toilet a couple of times, which was a palaver with obviously all the cables from your drip, and they had the monitor runners, and so that was a trip across the room to go into the ensuite to the toilet was like a military operation. But I was getting up and moving about, but that was as much. And I just kept thinking, oh, well, later on, because this could go on for hours. Yeah, people tell you induction takes forever. That maybe I'll want to get up and move around more then. But right now, I'm kind of happy where I am, and we're chatting, and
Yeah.
So 11:30-ish, I get the gas and air, and then about 20 past 12, 12:30. So 2 hours after I'd gone, oh yeah, they're definitely contractions. I said, this is really getting. I think I'm going to need something more.
Mm-hmm.
And she went, right, okay. So when they first put the drip on, they said, we won't examine you again until 1:30. That's, we'll leave it until then. And I was like, right, okay, that's fine by me, again, because I really didn't, it had been so bad. So when I said, this is getting sort of quite intense, she said, right, okay, do you mind if I examine you now? And I was like, no, that's fine, because I'd like to know, because honestly, if I've got another 10 hours of it being like this, I can't do it. And let's not mess about, and let's just go straight for an epidural, because I can't take it at this intensity for that much longer. She's like, okay, that's fine. So she examined it and she said, right, you're 9.5 centimetres.
Oh my.
Yeah. So this is why I say we don't know if the pessary had done more than we'd realised.
Yeah.
And I've since learned I must be lucky to have quite a high pain threshold.
Mm-hmm.
And I was like, oh, okay. She said, so the best I can probably give you is half a dose of diamorphine. And I was like, right, okay. She said, but the thing is, control drug, I need another midwife to come in. I'll go and get her. But it could take a few minutes. Yeah, it's fine. So by this point, it's probably 20 to 1.
Mm-hmm.
What feels like an eternity later, other midwife comes in and mid-contractions asking us for my name and date of birth, which was fun.
Right.
So eventually gave her that. She was like, I know, I'm really sorry, but if you're giving it, I've literally got the needle poised above your thigh. Okay. So she did that. And then I was like, I really feel like I'm pushing, and I'm not, like, it's not a conscious thing. It's like a reflex.
Yeah.
And friends who haven't had babies have asked me what it's like, and the only thing I can describe it as is it's the same sort of feeling as when you're going to throw up. That's what it felt like a completely involuntary reflex that I couldn't stop. And she said, if you can really, really try, because you just weren't quite, and I don't want that last bit of cervix to get in the way and that cause problems. And I was like, yeah, no, I mean, if you'd ever had a baby, you would know there was no stopping it.
Yeah.
So that was probably about 10 to 1. And between then and him being born, time has no meaning. But he was born at 17 minutes past 1.
Oh, wow.
So we'd gone from 10:30 in the morning to 17 minutes past 1. And that was as much of labour as I knew with an induction. And he was born, once she actually said, yeah, you can push, he was born within like a couple of pushes.
Amazing.
She did have and I had friends who tried to prepare us for this bit, so we had the whole speech of, right, when you get the next contraction, I'm going to ask you to push, but then I'm going to ask you to stop, and it's going to be really difficult, but you really need to try. And I really psyched myself up for it. She went, so really, really push, and then I'll ask you to stop. And I was like, right, okay, yeah, I can do this. But everybody's told us this is really important. And she went, right, okay, so if you put eyes out.
Right.
So I was like, so I psyched myself up for that. And she's like, yeah, baby's out. So he was born, he was crying, he was lovely.
Oh.
He was boy, which we hadn't known, which was really nice. And passed him open. I had sort of skin to skin.
Yeah.
And yeah, I just remember looking and thinking, oh wow, the baby's out. The baby's out. Yeah, he's been born. And also looking and thinking he looked exactly like my husband, like absolutely, you know, it was just him. So, I always say to people when they talk about induction being horrendous, I'm like, well, it wasn't for me, to be fair. I wouldn't have chosen it, but if I had to have it again, I would feel okay about it.
Yeah.
And I think some of that comes from the fact that, I didn't have to have what I would have felt were unnecessary examinations, and, people are different. And I'm the sort of person that if you tell me I need to put up with something for 2 hours, I can do it. I couldn't have coped with a long, slow labour as well, I don't think. Mm-hmm. Some people really need that, like, slow ramp up. I'm a bit more, I don't even mind if it's worse. I'd just rather it was quicker. So everybody reacts differently. So he was born. My husband cut the cord. And then placenta delivered without much fanfare, to be honest. It was quite forward, which was good. And then she said, there is quite a lot of bleeding. And, I've never had a baby before, so I didn't know what was normal or whatever. Yeah. She said, but I don't know if it's coming. I think you might have a tear. She said, I think I saw that when he was coming out. So what I'm going to do, and again, this was something that made me feel really sort of, I don't want to say respected, that might sound a bit dramatic, but I suppose that's what it is.
Yeah.
It was, she said, I'm not going to examine you to then potentially have to get the surgeon in to examine you again. I'm just going to get her straight in to check.
Right.
Because I don't see the point in putting you through it twice. Because I'm 99% certain of what I've already seen. So I'm just going to go and I'm going to buzz her in and get her to check. And then, if she doesn't need to take it to theatre for stitching, then that's fine, I'll just do it. But if she does, at least then you haven't had to be examined twice. And I was like, oh, great. Again, very relieved about that. So at this point, my mum went out to the car to get the baby bag and stuff, because again, we left all that stuff in the car because we thought we had ages.
Yeah.
And they say, like, don't bring too much clutter and stuff into the room. So she went off to get that with my husband, and the surgeon came in and she had a bit chat to us, and she did an examination, and she said, okay, so you've got what we would only just class as a 3rd degree tear. It is only just. Yeah. And if you really felt strongly about it, we could stitch it in the room. But we would be happier if we could take it to theatre with, the expression she actually used was proper lighting. Which at the time, yeah, because we're doing it by candlelight in here, are we? But yeah. She said, but I just think we can give you proper anaesthetic and we can make sure that we've not missed anything. And I was like, you know what, that's an area of the body that personally I don't want to take a chance with.
Yeah.
So she said that we will give you a spinal for that. And I remember thinking at the time, so I've done all this with next to no pain relief, and now I'm getting a spinal. What a waste. What a waste. I'd known. Could have had an epidural hours ago. But by the time then the anaesthetist came in, and my mum said to us after, she said, I walked back in and you were doing the consent with the anaesthetist, and she said it was like a different person, because clearly in the time I'd been out of the room, the diamorphine had kicked in, because you were no longer with it, and you just had this glazed expression as he was talking to you about all the risks, going,
Oh, my.
And she said to the midwife, so the diamorphine, would that have done anything for actually giving birth? And the midwife went, no. Basically, we gave her it to make her feel better. But she said it had obviously kicked in by the time I got back from the car. And so then off I went. I remember saying to the anaesthetist, I don't know how anybody sits this still for an epidural in labour, because I'm stressed out and I'm not having contractions or anything, like, you know. But it was fine. The epidural, the spinal, worked first time. And she said, "Oh, I've sewn the tear up. It was very, very, minor third degree tear, but at least we know that, we've got it." And then off I went back to recovery. With Lucas, he stayed with his dad and with my mum in the room.
Yeah.
So we went back to recovery, and they met me there with him. And I had a bit of I don't know if it was a bit of shock or if it was because I'd not eaten anything since like the night before, other than the packet of Velveeta biscuits, the contraband Velveeta biscuits. Oh. It's funny when the anaesthetist said, "Has she had anything to eat?" And me diamorphine state went, "Oh yeah, I had a packet of biscuits." And the anaesthetist looks at the midwife and she went, No, she doesn't mean she hasn't had a packet of hobnobs or something. Like, she means like a little packet of breakfast biscuits that she nibbled on. And he was like, "Oh, right, okay." But he was living quite a nice little chat, because he was saying, he was asking about the baby and stuff, and the RBI obviously looks out on St James's Park, and my husband's a Newcastle fan and was supposed to be at the match that day.
Oh.
But they lost. I mean, they lose a lot, but they lost. So we had a bit of chat about that and a bit of a joke. Anyway, we got back to recovery, and as I said, I don't know if it was because I'd not eaten very much, or if it was shock and adrenaline, or if it was the drugs that I'd had. But I was shaking really badly, and I just couldn't stop shaking. They had hot water bottles and stuff, and my mum was like, "You've got no colour in your face," and the promised tea and toast I never got. That makes me very sad. Right. I've heard all about how good the tea and toast after you give birth is, and I never got it. And I'd had, at one point in labour, which I forgot to say, they were a little bit worried about his heart rate. Yeah. And she said it's not massively concerning. I think he dehydrated. So they'd put me on a fluid drip in labour, and that had sorted that problem out. So they were still quite concerned and wanted to make sure that my fluid levels were all right and that I wasn't getting dehydrated as well. Mm-hmm. And she said, I said, "I really want a cup of tea. Like, I really want one." And she went, "I can't, you're still looking like you're dehydrated." And and I was like, "Oh, you can have some water." And I was like, "Oh, okay." And they kept asking if I wanted to try and feed him, and I did, but I was really actually frightened that I might not be able to hold him.
Right.
So eventually my midwife went off for a break, and another midwife came in. She said, "How are you doing, Pet?" And I said, "Oh, I'm all right, but I just want, like, I'm shaking and stuff." And she just looked at us and she went, "Have you had a cup of tea yet?" And I was like, "No, I really want a cup of tea." And she went, That'll sort you out. Because when I'd had the spinal, they put a catheter in, so that's how they were monitoring what fluid I was, like, what urine and stuff I was passing.
Yeah.
Because the fluid you're passing is a bit dark. Mm-hmm. I'm telling you, I'll go and get you a cup of tea, and in 10 minutes you'll be all right. And she was right. Literally, I had this cup of tea, and it was like magic. And my mum said the colour came back into your face, everything. So then they helped me feed him, and he fed for quite a long time, the first time. And he ended up actually being a really good feeder, to be honest. And then eventually they took me around to the ward, got me told. Joe's parents had driven up by this point from Manchester, so he'd made all the sort of the BBC phone calls. My mum had made some to, like, grandparents and things. Yeah. And then they went home. It must have been maybe 5 o'clock. And then Joe came back later with his parents for, like, evening visiting.
Yeah.
So they could meet the baby and stuff. And when he got back, I was like, "You can't leave until you find me something to eat." He said, "What do you mean?" And I said, "I haven't had anything to eat since last night. Like, I'm absolutely starving." And I genuinely, at this stage, don't care where you get it from. Like, I just need you to find... It was like some sort of military operation again, just to get bed. And he went out and he spoke to the midwife, and the midwife said, "Oh, I'm really sorry. It's because she missed tea time, because she didn't come round until after we'd done tea time. But I'll go and see where I can find her." So I had a sandwich and stuff, and then they stayed for visiting, and then went home. And then we really struggled with feeding in the beginning. I just couldn't get it right. Just couldn't get him in the right position. He didn't know what he was doing. I didn't know what I was doing, really.
Right.
And we fell into a bit of a trap where I could buzz. They would come. They would, clamber on the bed and get him latched, and then they would leave, and that would be fine until the next time you needed feeding.
Yeah.
And I just couldn't get him in the right position, or get me in the right position, or whatever. So I stayed the Saturday night out, and then they asked me if I wanted to stay another night, which I did. And we came home on the Monday.
Mm-hmm.
And I'd been a little bit worried, they'd kind of told me what the worst case scenario was with having a third degree tear. And said, you'll be referred for a women's physio appointment about 6 weeks after your birth. And this can happen, that can happen. It might be recommended if you have another baby that you have a cesarean. And that stuck with us for quite a long time, because I really didn't want to have a cesarean.
Yeah.
So we came home, and one of the best things that happened, and I think this must be a South Tyneside thing, because all my other friends, I don't know anybody in any other area where this happens. So if you're breastfeeding, the next morning, so we got home at lunchtime on the Monday,
yeah.
Tuesday morning at about 8:15, breastfeeding support woman just knocks at the door. We didn't know she was coming. We didn't have to ask for her to come. She just turned up.
Wow.
And honestly, she was like an angel, because she came in and she said, "Oh, is that not sore?" And I was like, "A little bit." And she went, "Right, come on." But rather than just her latching him on, she helped me do it, and she tweaked my arms and things like that, but she got me in the position where I could do it myself.
Yeah.
And don't get us wrong, we still had the times in the middle of the night where I just was sat going, I just can't do it. But it didn't take long. Looking back now, it took a couple of weeks. But she just, at that point in time, she was exactly what we needed. She came in, she helped me, she showed me how to feed him. And then she said, "Right, so he's finished on that side. Right, Dad, you change his nappy. This is your job now. You change his nappy." It was the first time Joe had changed his nappy. I'd done them all. And he would say now, it was a little bit like, you've never really we've never changed a baby's nappy before or anything. But somebody just coming in and going, "Right, okay, you do that." And that then became the routine while he was on paternity leave. Yeah. I would feed him. Joe would take him, change his nappy. Then I would feed him on the other side. And we were really lucky with him. So he would feed, and it used to take quite a long time. Feeds were long. Mm-hmm. But he would then sleep for 3 hours between them.
Wow.
So it was really good. His sleep did get progressively worse up to about 4 months old, and then after that settled back down. And we were quite lucky that even though he would wake up in the night to be fed, he would wake up to be fed, and once he was full, I could put him back down and he'd go straight back to sleep. We had no issue with that. Mm-hmm. So yeah, it took some doing, but I ended up feeding him until he was nearly 8 months old.
Wow, that's great.
And I don't know if I might have carried on longer, but he got to a stage in the very beginning. There were a few occasions where he had to take a bottle.
Yeah.
And I always feel really bad when I see people on forums going, "Oh, I'm trying to express and I'm not getting anything out, and I'm worried that, the baby's not getting enough," and blah, blah, blah. Because he never struggled to feed, but I'm rubbish at expressing. Nothing comes out when I express. Mm-hmm. But he was a proper, monster baby. He was 7'4" when he was born. Mm-hmm. And he never lost weight. And I think by 6 weeks, he was 10 pounds or something. He was obviously getting the milk out, no issue. Mm-hmm. But he had a few express bottles when he was younger, up until the first couple of months. And then we had a period of time where we didn't need to give him a bottle, so he didn't have one. And then refused. And it got to a stage where we worked so hard to get him to take a bottle that I just thought, I think I'm ready to be done now. And what we did is, during the day he used to have bottles, but I used to feed him overnight.
Yeah.
And then gradually, obviously he got, he was really good with solids as well. So once he started eating more solids during the day, he wanted less milk anyway.
Mm-hmm.
And we just, it got to the point where he was only waking up maybe once a night. And there was no big dramatic, like, I'm not going to feed him anymore. We just weaned it down. And I just remember feeding him in the middle of the night one night and thinking, yeah, I don't think I'll do this again. And it was so strange, but actually probably the best way to do it.
Yeah.
So, yeah, then he thrived. I was really lucky, healed really well. It was sent home with some really good pain relief and stuff.
Amazing.
So didn't struggle really at all, considering how I thought I might, because I think I had this impression in my head from what I'd heard about people who had, third degree tears and stuff, that it was horrendous. And, I'd heard all the horror stories about not being able to sit down, and I just didn't, don't get us wrong, you're very careful with the area.
Yeah.
But it wasn't like I couldn't walk or I couldn't, get up and move about or anything like that. So, and we were lucky because the breastfeeding support team, they just turn up on the first day after you come out, and then any time you would ring them, and we did get them out another time. We rang up and they came out within a couple of hours and sit with you, and I really think that made all the difference. I think if we'd not had that, I wouldn't have fed him. I'd have given up definitely by 6 weeks, definitely.
Mm-hmm. Mm-hmm.
So for me, I was sort of that support, that combined with the midwife, who was really lovely, and very sort of, she made you feel quite confident about things. So I remember going to see her not long before I had him, and heard the midwife saying, "You'll be fine. You'll be fine. I can just tell. You'll be all right." And like, she had nothing to base that on. I'm sure she was just saying it to make me feel better, but it did make me feel better. So
yeah.
And it's sometimes little things like that actually have more of an impact than I suppose I would have thought it would have done. So yeah, that was him.
No, of course, language is so important, especially with new mums and pregnancy and birth. A lot of people don't really think about it at the time, but then there are moments where you can just remember what someone said or hasn't said.
Mm-hmm.
Exactly. And it just sounds amazing of how you've worded it in terms of the support you received, but also how capable you were as well, and are.
I think that's the thing, it makes you feel, because it's really, especially with your first baby, I don't necessarily think it completely goes away however many children you have, but I think definitely with your first, I felt like, when's the adult coming? Like, when's the grown-up coming to tell me what I should be doing? Oh, that's me. And I think I've heard a lot of people say this over the years.
Yeah.
It's really hard for husbands because they don't mean to do it, but they look at you as if you should know.
Yeah.
And you're like, yeah, but I haven't done this before either. So, and I think a lot of times that can cause like a lot of friction, because you're sitting there going, well, I don't know what I'm doing, but I haven't got a choice. I've got to get on with it.
Mm-hmm.
And your husband or your partner is there saying, like, not meaning to, but they just defer to you because you often are putting out this image to them that you do know what you're doing. And sometimes you do just need somebody who you know knows what they're doing, like a midwife or a health visitor or whatever, to say to you, you can do this. In fact, not you can, you are doing it. Like,
exactly, yeah.
I don't think as I say, it wasn't until afterwards that, and like you just said, that little things that people said actually make all of a difference. I remember at one point, I think it was just after I'd asked for gas and air, just before I asked for gas and air, sorry. And the midwife had gone for a break, and another midwife came in, and I said, "Oh, she said if I needed any pain relief to ask, and I think I might need some paracetamol. And she went, all right then. I like laughed, and I went, what? And she went, why, is that all you want? And I said, well, I mean, yeah, for now. And she went, you're going to be fine. If you're just asking for paracetamol now, looking at them contractions, you're going to be fine.
Oh.
And again, like, it's nothing. It's to her, it's probably a nothing. But to me, at the time, it was like, all right, okay, yeah. That just gives you that little boost to make you think.
Definitely.
Yeah. So I had, overall, I always say to people, I think I had a really good experience.
Yeah, yeah, and it sounds like you're definitely at peace, and you're looking back at that experience with nothing but sort of concrete feelings towards it.
Yeah, I don't have any sort of. I definitely went into my second pregnancy having learned some things. I think we all do. I think that anybody who has a second pregnancy or a second child, you learn from it. But I didn't feel like I'd been sort of cheated or not listened to or any of those awful things that you sometimes hear about.
Yeah.
But I did do the birth reflection service.
Wonderful.
And it was quite a long time. I think he was over a year by the time I actually. And the thing that put me off doing it, if I'm honest, is because I didn't feel like it was a service for people like me.
Right.
I thought it was for people who'd had properly traumatic births and were suffering the trauma. And for me, what I wanted from it was there were lots of things that I sort of thought I remembered.
Yeah.
Or had happened. And theories I'd come up with about things after the fact, and sitting down with somebody and just going through what happened, saying, "Oh, well, I remember that happening at that point," and saying, "I'm pushing, I'm pushing, and I'm not trying to." And the midwife said, "Yeah, I can see here. She's written, Laura is involuntarily pushing." And I said, I just couldn't stop. And she went, you wouldn't have been able to. At that point, you wouldn't have been able to. And I was like, oh, right, okay.
Yeah.
And just little things like that probably wouldn't have made any difference to the outcome at all. But it's that knowing in your mind that what you think is right and you're remembering it correctly. So me going, all right, so I am right to think that and I am right to think that. And the other thing that really, really helped was at 6 weeks postpartum, I saw the women's physio, and she checked the scarring and the stitches and everything, and said everything was healing absolutely fine, and did like a thorough check on my pelvic floor muscles and stuff. And I also saw the consultant at that point, and she said, based on everything that I'm saying now and everything that you're telling me, if you want to have any more children, I would absolutely support you going for a natural delivery. I don't think there's a need for you to have a cesarean, and there's absolutely no reason for you to think about or decide about that now. But I would support you having that. By the same token, if you don't want to risk another third-degree tear, I also understand that, and we would support you in having a cesarean. Amazing. And I was like, yeah, and again, that sort of was a complete contradiction to what I'd heard a lot of people say, which was either way, they'd had a fight on their hands.
Yeah.
And I just didn't have that, I didn't have that experience at all. And that was the thing that had bothered me for sort of those 6 weeks, that 6 week period. It had played on my mind a little bit because I really, really don't want to have a cesarean, and I don't feel like it's necessary. I don't have any issues following the surgery or anything like that. And just put my mind at rest straight away, and I could just put that to one side and not have to think about it until I decided I want to have another baby. So
yeah, definitely. And it's nice to hear that you were then validated during that time.
Yeah, I think again sometimes people often feel like it's just what they think, and it's not necessarily, it isn't validated, as you say. And that was what I got from that that birth reflection service that there was no other way I was going to get that, because nobody else, my husband was there, my mum was there, but to go through those really detailed notes that the midwives have to make, and go through it step by step, and somebody go, no, that would be right. Oh yeah, she's written that in here, or that made me go, oh well, yeah, I am right in what I think, and my version of what happened is accurate. I'm not misremembering it, or anything like that.
Yeah. And it's great that you had the opportunity to engage in the services, because as you said, you went under the impression that they were for you in your experience, but it's great that you're discussing it now and proving that it's for anyone and everyone who needs it.
Yeah, definitely. It's just such a shame, because I don't know about other parts of the country, but I know at the RVI it's a voluntary thing that the midwives volunteer to do.
Yeah.
Or it certainly was then, which is like 4 years ago. And it's a shame that it's not something that's just like a standard service. Obviously, we all know what the issue with funding is and stuff, but I can just, even just in my circle of friends and family, I know so many women who would benefit from it. It's just such a shame that it's something that can't be standard. And the same with the follow-up with the women's physio. I know for example, in France, that's a standard thing.
Yeah.
For any woman who has a baby, they have that examination and stuff afterwards.
Mm-hmm.
And you just wonder how many women are living with things they don't need to live with. And that's the shame, I suppose.
Definitely, yeah. I totally agree with what you're saying in terms of that. And I'm sure people who listen to your story will then realise that these options are available and it's something they can ask about.
Oh, yeah, definitely. And I think, as I say, I was fortunate that I'd read it in the back of the books that they give you when you book in at the RVI. I knew it was there.
Yeah.
And sort of thought about it for quite a long time before I did it and actually bit the bullet.
Mm-hmm.
But I'm sure there are other similar services in other, and if it provokes somebody to go and investigate whether or not it's available, then I really think it would benefit a lot of people, because it did. As I say, I never considered it that I'd had a traumatic experience, but even for me, it made me feel so much more, as you said, at peace. I think that's a really good way of describing it.
Definitely. And then considering you'd received that care and that support, what then pushed you to have a second? Was it something that you'd thought about, or did it just happen?
No, so I was going to say I'm an only child. That's not technically true. So I've got step and half siblings, but
yeah,
I grew up with just my mum, really.
Mm-hmm.
My husband's one of two, and I had always wanted more than one child. I'd kind of kept my options open, in so much as, if we'd had Lucas and I thought I can't do this again, then that's fine. But in the back of my mind, he was always going to have a sibling, hopefully. And we'd always sort of thought we'd wait until he was maybe 3 or 4. As I say, I was only 29 when he was born, so it wasn't like time was particularly an issue.
Yeah.
Joe was a couple of years younger than me. And there's the practicality of having a second one, which is if we waited until Lucas was 3, that would mean he'd be getting his free childcare hours, and we could, financially it would be a lot easier than having 2 in nursery at the same time and things.
Yeah.
So he turned 3. Is that right? Yeah, he turned 3 in September.
Mm-hmm.
And I had gotten the contraceptive implant when he was born.
Right.
So that lasted 3 years. So that I got that removed, and then again we knew we wanted another one, and I had the implant removed, but we weren't actively trying. I would say there was no plotting of cycles and this, that, and the other.
Yeah.
And we thought we'd give it a couple of months, see what happened, and then think about it probably more with purpose in the new year.
Yeah.
And I got that removed at the end of September, October time. And then on February the 13th, the day before Valentine's Day, I had one of these really terrible, as a woman in her 30s, I should know better. And I was like, maybe I should do a test because that's been a while. At which point Joe was like, what, do I need to go to the shop? Do I need to go and get a test? What needs to happen? Blah, 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 blah. And I was a bit like, because again, fell pregnant straight away first time. Surely it's not going to happen again.
Yeah.
I had loads of friends who struggled the second time, even if they'd had no problems the first time. So I was like, no, it won't be. And I was pregnant. It was positive.
Oh, wow.
And again, I still, even though this was the second time I'd done it, I still felt like, because, who's lucky enough for it to happen straightforwardly both times? Like, that's, I know we're really lucky.
Mm-hmm.
And sort of was a bit more, I don't want to say a bit more blasé about it because that's not true. I actually worried a lot more second time around.
Right.
Worried a lot more about niggles and aches and pains, which I seemed to get more of, whether that's because I was older and had Lucas to look after, or I don't know. But it was different. I felt different. I also probably wasn't in as good a physical shape as I'd intended. Because again, I thought, well, after the new year, I'll, get back out to go and running, and I'll stop eating rubbish, and, I'll be in a better position if I fall pregnant. And of course, that never happened. But I was a bit more like, I didn't need to ring the doctors immediately the next day and tell them. I gave it a couple of days and things like that.
Yeah.
And again, I was lucky. It was a straightforward pregnancy. I had a few more little niggly things, but no serious complications. At about 10 weeks, I had some pain. And I didn't know if it was just normal things of stretching and moving, but I hadn't had it the first time, and because it was sort of on one side,
mm-hmm.
I did get referred for a scan just to make sure that the pregnancy was where it was supposed to be.
Yeah.
And it was, and she said, it's absolutely fine. It's obviously just, one of those things. And then I did my booking in bloods and urine sample. I found out I had group B strep.
Right.
Which I hadn't had the first time round. And I did quite a lot of reading on it, which initially worried us quite a lot, and maybe that was partly why I worried more during the second pregnancy as well.
Mm-hmm.
Gave me a course of antibiotics, which were awful. I normally don't react badly to medication, but these were obviously ones that were specifically for that, and a type that you could take when you were pregnant, and the my doctor's really sick, and I had a lot more nausea and stuff this time.
Right.
A lot more vomiting.
Mm-hmm.
And she said, obviously, when you go in to have the baby, there's a couple of things you need to be aware of. If your water's break, you need to go in straight away, and you need to get a course of antibiotics intravenously, and I think they have to be at least 4 hours or 6 hours, I can't remember which way around it was, before the baby's born, so that you have time to cross the placenta, because the baby can pick up the infection while it's being born, and it's the sort of thing, as an adult, we live with without, it's not something you know you have, it doesn't cause you any issues, but obviously if a baby contracts it, it can be quite dangerous for them.
Right. So
I sort of had all of this in my mind. I went away and did a bit of reading and stuff, and the thing that I still had in my heart was that I wanted to have this water birth in the RBI birthing centre.
Yeah.
So it was still there. That was still my aim. And I did actually ring them and check, because I'd seen somewhere that they now allowed you to have a water birth in the birthing centre if you had group B strep.
Mm-hmm.
But in the literature, which was old literature, it still said that you couldn't. And I was sure that that's what I'd been told, but I rang and checked that, and yes, that would be fine. So kind of merrily went along after that. When I was about 36 weeks, 35, 36, it was Lucas's birthday. So his birthday was the 19th of September and she was due the 19th of October.
Oh, wow.
And so I was getting stuff ready for him. He was at nursery and Joe had been away for the night with work, but I was off work that day in the house doing stuff. And I wasn't happy with their movements. So went and got checked. Obviously, again, as soon as they put the monitor on, absolutely fine, because that's 9 times out of 10, I think, what happens.
Right.
But again, my experience was, as soon as I rang up and said, they just don't seem right, or they don't seem as frequent, or they don't seem as strong, they're just not the same, straight away, just come in, we'll get you checked. There was never a hesitation about it. So I had reduced movements then, had low iron this time around, and we had one course of iron tablets which knocked me sick.
Right.
And I told the midwife, and the midwife said, there's 2 different types that they can give you. And she said, we always prescribe one because most women react badly to the other one, but the other one's cheaper. So when it gets through to the doctor often prescribes the cheaper alternative.
Right.
And it's just a waste because you're now going to have to bin all of those tablets anyway, because you can't take them because they make you vomit. And we're going to have to give you the others anyway, so it's actually ended up costing double what it would have done to just do the ones that are marginally more expensive in the first place.
Yeah.
And I was like, okay, but I don't have to take these anymore. She's like, no. And my iron levels did come back up, actually. But she said, I was quite close to giving birth at that point. She said, I'd rather you just kept taking them because your iron levels have come back up, but they're borderline, and obviously we know you're going to give birth, so... I do shamefully have to admit I was supposed to carry on taking them after I'd had the baby, and I didn't.
Well, it's all up to you and what you want to do.
Well, I did for the first maybe week or so, and then I just, I had a newborn and a toddler, and I guess 4-year-old, and I was like, I've forgotten for like 5 days. I feel all right. So,
yeah.
Obviously, I didn't tell the midwife that. But it was all dead straightforward. As I said, the things that I had weren't big things. I never had problems with like fluid retention or blood pressure or any of the other typical things that you might get. So again, it was a harder pregnancy, but it wasn't a hard pregnancy. It was just harder.
Yeah.
And yeah, I saw the midwife. Again, I think I saw her at 38 weeks.
Right.
And then she booked us in to come to the house on my due date. Well, not on my due date. My due date was a Saturday, but to come that Monday.
Yeah.
And again, I was like, all right, okay, well, I've got no real expectation because I thought I'd go over first time and I didn't. And all the way through being pregnant, or from maybe like 16, 20 weeks, something like that, every time I saw the midwife, she said, now, what I want to remind you is this is a second baby. Sometimes they come quickly. Don't hang about. And I said, I don't know what that means. Because I didn't go into labour last time. But she just kept saying the same thing. Don't hang about. And I was like, I don't know what that means.
Yeah.
I need a benchmark. And when I would tell people, they're like, but you've had a baby before. And I'm like, yeah, but, so I had that in the back of my mind. But I thought, I have had a baby before, and I will know if they're contractions. I'll know what they feel like. So, evidently I'm an idiot.
Right.
Because she was due on the Saturday, which is the 19th, and this time around I went for some reflexology all the way through pregnancy, which I don't know if it does anything, but it's a lovely way to spend an hour, and it made me feel nice.
That's
so
nice.
That's good enough for me. And I'd been for a reflexology appointment on the Saturday, and then we didn't do very much. And the Sunday, the cat, we had at the time had 2 cats, and one of them was very, very poorly, so she was in the vet. and it was very, very upsetting time. We were getting loads of phone calls and things, and I was probably really preoccupied with that. So on a Sunday, we went to go and see Joe's parents. Remember those times pre-COVID when you could just go and visit your family?
Oh, yeah.
Like,
what is that?
Yeah, remember that?
Yeah.
It was only a year ago. So we drove up to see them. They live in Northumberland, and the idea was that we would go have lunch, we'd leave Lucas there, and then we would drive him back to Gosforth to see the cat in the vet and decide what was going to happen next.
Right.
So it ended up being a really horrific night where she just got worse and worse and worse, and Lucas ended up staying the night at Joe's parents, and we ended up having to have the cat put to sleep. It was awful. Obviously, I was really, really upset. And then it was, by the time everything got sorted out and stuff, it was like 8:30 on a Sunday night, and we were driving back home. Mm-hmm. So get home, sorted, and then I suddenly sort of thought, I don't know how much movement I've felt today. And again, I don't know if I was just so preoccupied that the baby was moving, but I hadn't registered it.
Right.
Or, I don't know. But Joe was like, "We'll ring them and we'll go back in and check." And I'm like, okay, I know this is the right thing to do. The last thing I want to do now is get back in the car and but I have to. Mm-hmm. And I said to him, "Look, I'm a day overdue. If there's any doubt, they'll not hang about. As far as they'll be concerned, if there's any concern for the baby, it's full term. Let's not mess about.
Yeah. So
be prepared that they might just ask us to stay in." And he was like, "Okay." So we went up. I rang them, and then we went up and they put us on the monitor. And again, absolutely fine.
Yeah.
I still wasn't convinced that the movements were quite right. Mm-hmm, mm-hmm. And I had like some funny feelings, but I couldn't put my finger on what it was, and they were happy with everything they were saying.
Yeah.
I could stay longer, and they would monitor us for longer, and if I wanted to come back later on, if things still weren't right, to come back. So it wasn't like I felt like they were just pushing us out and I was being a bit dramatic.
Yeah.
But I just put it down to I'd had a really horrific day, combination of things. I hadn't eaten very well. I had lunch, but then this is like probably 9 o'clock by this point.
Yeah. And
I hadn't really eaten anything since, and so away we come home. And I slept reasonably well. Mm-hmm. I was a bit unsettled, but again, I was heavily pregnant and had a really upsetting time. So I just thought,
exactly,
that's what it is.
Yeah.
Yeah, that's totally. I didn't think anything of it. And Joe got up to go and pick Lucas up from his parents so that he could then drop him at nursery. And I was up and down a bit, and then I just sort of became aware. I was like, I think these might be very, very mild contractions.
Right.
But when I say mild, I mean I'd had Braxton Hicks that were more painful. So it wasn't like they weren't anything. And I rang him and I was like, "But where are you? Why are you not back?" And he said, Lucas had an unsettled night. He was just a bit out of like his routine and stuff, and woke up. So when I got here to pick him up, he was actually still in bed. By the time they got him back to sleep and stuff, they'd let him sleep in. Yeah. And I was like, "All right, okay." He said, "But I'm going to be leaving shortly." And I said, "All right, okay." I said, I think something might be happening, but I don't think it's going to be a day, but I think we're getting there, I think. Mm-hmm. All right, okay, well, the midwife's coming today anyways, and I said, yeah, so, we'll know one way or another. And so that was probably about 9:30 in the morning.
Yeah.
And, hindsight's a wonderful thing, because I got up and I got in the shower, which I felt like was the dirtiest shower I'd ever seen in my life. Absolutely had to be scrubbed there and then. And maybe that was a sign.
Nice.
Maybe. And then the midwife turned up, I want to say it was about 11:30. Mm-hmm. And I'd been so busy cleaning and stuff, I was out of the shower and dressed, but like my hair was still wet and everything. So she brought the student with her and she said, I said, I think something might be happening, but I don't think it's imminent. I think I've got time. And she was like, all right, well, if you want, we can try and do a sweep, but we'll do an examination anyway. And if we can, we will, if that's what you want. And I said, yeah. So she did all the other checks, like blood pressure and everything.
Yeah.
And then she said, do you mind if the student does the examination and stuff? And I was like, no, that's fine. So off we troop, and she's doing the examination and stuff, and she's like, oh yeah, I think I'll be able to do a sweep, blah, blah, blah. So then the examination's finished, and the midwife says to her, okay, so it takes all these different, they do all different measurements and things, don't they?
Yeah.
And she said, and dilation? She was like, I'm going to say, 5 centimetres.
Wow.
And I was like, pardon? Now, bearing in mind, when I'd gone in with Lucas and my waters had gone, and they were like, nothing's happening, it's not softened, it's not dilated, it's not nothing.
Yeah.
And I'm like, So again, the midwife said, so obviously we've done the sweep now, and you were already having contractions, so things might pick up. Mm-hmm. And I was like, okay. Don't hang about. And I'm like, I still don't know what that means. Still don't know what that means. But I just said, I won't. So she was probably here about 45 minutes, we were here quite a while. Mm-hmm. And then she left, and I had 2 slices of toast and a cup of tea, and went got that on my birthing ball, which is what she told me to do.
Yeah.
Because what she said was, the baby's head, although it was down and it was starting to engage, it was like slightly off-centered, I think was how she phrased it. Mm-hmm. So she said, if you get on your birthing ball, that'll help it like settle into the right position. But when it does drop, things might progress quite quickly.
Right.
And I was like, all right, okay. So off she went, and Joe's parents came through actually to help us, because we had to bury the cat, which is, I sometimes feel like my life's a bit ridiculous, but so they were coming through anyway. Mm-hmm. And when they got there, got to our house, I'm sitting on my birthing ball watching the Harry and Meghan documentary, right. And Joe's in the kitchen pottering about, and him and his dad go out, and they're looking at the garden and whatever, and I'm talking to his mum, and she's like, you seem all right, you seem very calm. No, but I feel all right. Mm-hmm. Like, I definitely know I'm having them, but I could still talk through them, which obviously that's one of the things they tell you to look out for, isn't it? And
yeah.
So I'd rang my mum at 1 o'clock when she started our lunch break at work and said, I think it might be today, but I don't think you need to leave work. I don't think there's any urgency. She said, all right, well, I'll be on my lunch until 2. Give us a call back at 2 and see how you feel. Mm-hmm. And I was like, okay. But I don't think you'll need to leave work early. Maybe come through straight after work. And she's like, all right, well, I might take some time and all this, like, blah, 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 blah. So at about 10 to 2, I was like, oh, these are getting a bit ouchy now. Oh, yeah. And it sort of changed where previously I could just sit and bounce on the ball through them. Mm-hmm. I was struggling to find a position that was helpful, and they just had changed.
Yeah.
And I thought, oh, maybe this is what she meant by don't hang about. Mm-hmm. So I said to Joe, I'm going to go and ring the birthing centre. I'm going to go upstairs and ring the birthing centre. So I rang them and spoke to this midwife, and I was like, all right, I'm giving me name and everything. And she went, all right, and is this your first baby? And I went, no. And I feel like they always take you a little bit more seriously the minute you say that.
Yeah.
And I said, I'm having contractions. They're pretty regular. They're getting quite intense now. Mm-hmm. And I got one while I was on the phone, and I couldn't talk through it. Mm-hmm. And she went, right. She said, I said, the midwife's been this morning. She went, all right, and what did she say? And I said, oh, well, she said I was 5 centimetres, but the baby's head wasn't in the right position. She went, and were you having contractions then? And I said, yeah. And she went, what, why are you still at home? And I was like, oh, because I'm fine. And she was like, yeah, I think you should come in. And I was like, oh, all right, okay then. Yeah. She said, have you had any painkillers? I said, no. And she went, oh, go and take 2 paracetamol. That might be all you get. And I like laughed.
Yeah.
I came downstairs, I took me 2 painkillers and I was laughing. It's maybe all I get. And she was like, so we need to go then. And I was like, yeah, I'm going to ring my mum. So rings me mum. All right, well, I'll just go and tell them and I'll come now. And she works in pretty much in the centre of Durham, so she's probably only 20-25 minutes from our house.
Yeah.
And then, again, benefit of hindsight, and I probably should have known better. I've had a baby before. I thought, I think I need to go to the loo before I go. So I went up came up to the ensuite, and I got this contraction sitting on the toilet that was like nothing I've ever felt in my life. Like, I've heard people describe them as intense, and I don't think I ever, even when I had Lucas, I don't think I necessarily understood that. But that was the only thing the only word that could come to mind to describe it was just intense, like overwhelming. Joe came running in and was like, "You all right?" And I'm like, "Don't know." That was very different. And I went to wipe, and there was bright red blood. Now, this had obviously not been something I'd had any idea about when I had Lucas, because I was in hospital. I never got up and moved around.
Yeah.
So I don't know, you know. And he was like, "Is that normal?" And I'm like, "I don't know." "Well, why don't you ring them back?" So he rang the birthing centre back and said, "My wife's just been on the phone," and it was the same midwife. And she said, "Laura, yeah, I've just spoken to her. Is everything all right?" And he said, "Well," and then he said, "Actually, I'll just put her on speakerphone." I said, "I'll just come to the toilet," and da-da-da. And she was like, "Right, it probably just means that things have progressed a little bit fast."
Mm-hmm.
I was like, "All right, okay." She went, "How far away are you?" And I said, "I don't know, probably 20-25 minutes." And she went, "Right, if you want to come now." And then the immortal words that I don't think I'll ever forget were, "If you don't think you're going to make it,
right,
ring 999. And I was like, "Oh, that's not going to happen. That's not going to happen."
Mm-hmm.
So we come downstairs, we get in the car. My mother-in-law's like, "Do you want your cardigan?" I'm like, "No, I don't want my cardigan. Thanks, that's fine." And basically just left them in the house, just left. And then we sort of drove to the bottom of the street, and then we lived down a hill, a big hill. And I got a contraction, and I just said to Joe, I'm doing my best, but these are like really painful. And of course, I'm sitting in the car, so it's not the ideal.
Yeah.
Nowhere to go, is there? There's nothing to, you can't do anything to help them. So I'm doing my best. And he's like, "It's fine, you're fine." And then I got another 2 in pretty quick succession. And we got to some traffic lights, and I just said, "We're not going to make it. I'm not going to make it to the hospital."
Right.
"What?" And I went, "Yeah." And he went, "Are you sure?" And I went, "Sure." And he just very calmly dialed 999 from the hands-free.
Right.
And we pulled over into an Aldi car park.
Right.
Because, obviously, for anybody who doesn't live in the area, they won't know, but we were about to join a road called the Felon Bypass, which leads to the Town Bridge. And I did not fancy giving birth on either of those roads.
Yeah.
So this seemed like a better option. And we got through to the call handler, who was lovely, and asked for my date of birth, which Joe gave him incorrectly. Got this month in the year right, got the date wrong. And then they said, "Right, it's category 1, we're sending somebody now." And funny things like he kept saying to Joe, can you see the baby's head?" And I was like, "I can tell you now, you won't be able to see the head yet, but it's coming. It's definitely coming." And I kind of had in the back of my mind that once I knew that when I had Lucas, once I'd started pushing, it wasn't very long.
Yeah.
So I was like, "You might not be able to see now, but it won't take very long for the baby to be here." And he was like, at one point, I thought, I'm going to have to try and see what I can feel. He just kept asking. And it's funny now, it wasn't funny at the time. I reached down and I was like, "Oh my God, what's that?" That feels like I'm like, I don't know, is it an internal organ? Is my liver on its way out or something? It was only when the paramedic turned up and asked me if my waters had gone, and I said no. I thought, that's what that'll have been.
Yeah.
My water's bulging. So he said, they're on the way. And in my mind, I'd sort of, you tell yourself things to comfort yourself, don't you? So it was going to be all right when the ambulance got there. Yeah. It was going to be all right because it was going to be a nice big boxy ambulance that had medical equipment, and we were going to be fine, and there was going to be a professional there. Yeah. And Joe said, how far away are they? And he said, they're not far. They're coming along, and gave the name of a road. And he was like, all right. He said, they're in a fast response car. And I actually went, oh no, because in my head, a big boxy ambulance was going to be coming and it was going to be fine. Yeah. And then a few minutes later, they turned up. It felt like 100 years. Mm-hmm. But it wasn't that long. And nearly went into the wrong supermarket car park because there's a little opposite the Aldi. You had to wave them in from the other, because they pulled at the other one, so I swing around and come out. Anyway, paramedic gets out and, hello, my name's Ian. How are you doing? Well, that was it. I've had better days. I'm not going to lie. And that was, what time would that have been? So that was like just before 10 to 3. Mm-hmm. And they did like me pulse ox and stuff. Mm-hmm. And got the gas and air out. I was very happy to see that. Yeah. I mean, it didn't really do anything for the pain, but it makes you feel a bit better. Mm-hmm. And he said to us, have your waters broken? And I said, no. Mm-hmm. And he went, right. And he turned to the other paramedic and said, we might have time. And then I had a contraction. And he went, doesn't matter. I've got time. Mm-hmm. And then the next contraction I had the gas and air for. And I felt my waters go. Right. And in the middle of that, he had gotten Joe to, because we had both car seats in the back of the car, mm-hmm. So I couldn't even get on the back seat. Right. So we sort of reclined the front seat as much as we could and pushed it back as much as we could. And then I got another contraction. I just sort of felt the paramedic touch the side of my leg and go, can you just move that leg for us? Mm-hmm. And I was like, oh. And 2 pushes later, she was out. Wow. The front seat of the car. At some point in that period of time, an ambulance did arrive. Mm-hmm. I don't know when that happened, but right. I know that when she was born, the other ambulance, the actual ambulance was there. Mm-hmm. And we looked at the timings, and from the lovely Ian, the paramedic arriving, mm-hmm. to Iris being born was 6 minutes. Right. So I definitely wouldn't have made it to the hospital. And yeah, it was just, I think, unless you've had a baby, you don't know either, or necessarily always realise. Once they're born, you're totally fine. Mm-hmm. It's all over, and you're back with it, and it's okay. But in the heat of a contraction, nothing else exists. I could not care one bit about the fact that there were people milling around in the car park, putting their shopping in the car. I vividly remember there being a DPD van who had pulled into the back corner of the supermarket car park to eat his sandwiches, who stayed and watched the whole thing unfold. Right. And I remember all of that. And she was born, and we were trying to keep her warm and stuff and wrapped her up. And I was conscious that I felt like I was losing quite a lot of blood. Mm-hmm. And he said, I'm really sorry. There's nothing else I can ask you to do other than to step out of the car and sit on the stretcher. We can't lift you out because you're in the front seat of the car. Yeah. And I was like, no, that's fine. So got out and got in the ambulance. Mm-hmm. And then there was this whole thing about, right, so you booked at the RVI, so we'll take you there. Mm-hmm. Has anybody got the phone number for the RVI? And I was like, on my mobile. do you want to go and get me more? So we had this whole thing about, would Joe come in the ambulance or would he follow us in the car? And there was all this commotion. But all the time, I still hadn't delivered the placenta.
Right.
And that, I think, was more what was concerning, because he was like, I think that's why you're still bleeding, because that's not, you've not delivered the placenta. So eventually it was decided that because of that, it would be a blue light transfer, so Joe would have to put in the car.
Yeah.
And in the midst of all this, there'd been various phone calls to his mum. So when we first left the house, to say, don't bother coming to the house, just go straight to the hospital, because we're going to the hospital, we couldn't wait for you. Then Joe rang him and said, you're going to get to the hospital before we are, because Laura said she wasn't going to make it, and the ambulance has just arrived. Then he rang her back and said, the baby's been born.
Right.
They're in an ambulance. Can you go down to the maternity ward to meet her? Because you're obviously already there. So all that kind of commotion happened. As it was, actually, when we just pulled up outside the RBI and to deliver the placenta. So by the time I got there, they were less concerned. But it was quite funny, because they took us straight up to the delivery suite bit upstairs.
Yeah.
And when they got there, they were like, what were you doing? He said, well, we've just brought her in. But she's already had the baby. Like, yeah. We'd rang you. Oh, we were expecting you in the birthing centre. He said, I'm not being funny. I don't think that's where she needs to be. So, then there was the whole sort of checking me over and stuff, and when we checked her over, she was absolutely fine. She was a dainty £9 one.
Wow.
So quite a lot bigger than Lucas had been. And I'd had this idea, obviously, the whole time I was pregnant, that a second birth was going to be better, because I was going to be in the water, and it was going to be a controlled delivery, and that would stop the risk of, another tear and all this.
Yeah.
And that's obviously all totally gone out the window. And I actually had a male midwife when I got to the hospital.
Wow.
And he was lovely. He was really lovely. And my mum said to us after, she said, obviously, I was walking along the corridor and they told us which room you were in. And you can, I can't imagine how she must have felt. It's been awful. And she said, then I heard you laughing. I could hear you laughing, and I thought, she's obviously all right. And, it made her feel better. But he was really lovely. And so there was the placenta had come away, but there was like some bits of tissue-y type stuff. I don't know what it was. I think from the bag. I think from the bag of waters. I think that was like the membrane.
Yeah.
So he said, I'm really sorry, but that's got to come out. You can't leave that there. And that could, like, a lot of the bleeding stopped from that. Then he said, and it was almost exactly the same words as when I'd had lupus. It's just a 3rd degree tear. It's ever so slightly, and I essentially had exactly the same thing again.
Wow.
And he said, we'll get the consultant in to have a look at it and stuff. But yeah, now I've cleaned out all of that, like the membrane tissue and stuff. That's what's there. And I was like, okay. And he's like, you've taken this remarkably well. And I said, well, this is exactly what happened last time. So I'm not worried about it, because I know what to expect.
Yeah.
I'm not, you know what I mean? And he was like, oh, great, okay then. So consultant came along and checked, and again said exactly the same thing. We could maybe repair it in the room, blah, blah, blah. And I was like, no, let's not take the chance, let's do it. An anaesthetist came along, and she said, so this happened before, I understand? And I went, yes. And she went, and you had a spinal? And I said, yes. And she said, and you were happy with that? And I went, yes. And she went, well, we'll do that again then.
Yeah, right.
Great. And it was really surreal, but I think, and she said, can I ask why you didn't go for a section? And I said, well, I'd hoped to avoid this, but what I had hoped for was to give birth in the water, in the birthing centre, with a nice, slow, controlled delivery. And I didn't anticipate a baby 2 pounds bigger than the last one. So I think, given that I had her in the car really fast and she's 9 pounds, to just get away with the same thing again is probably actually not bad. And she, just sort of laughed, and I was like, but, I feel fine about it. And the difference this time, I think because I wasn't properly booked in or anything anywhere, they went to take me down the corridor, and the anaesthetist said, "Oh, let's have a look. Where's the baby?" And I said, "Oh, she's with her dad and my mum and back in the room. They're finishing," because I'd started to dress her, and then they were taking us out to the theatre, so they were finished not putting her clothes on. And they were like, "No, baby has to stay with you. Baby has to stay with you." And I think it's because she wasn't all tagged up and stuff.
Right.
So we had to stop in the corridor until he brought her, and then she was in a little plastic box in the corner while I was in theatre. Although she wasn't in there the whole time, because the anaesthetist did say, "Do you mind if I go and get her and have a cuddle, and I'll come and show it to you?" And I was like, "Yeah, it's fine." But that was nice that, something else to think about while you're having stitches done.
Yeah.
And then same thing, got back to recovery, no toast, still never had tea and toast after I've given birth. I feel hideously cheated. But I did get a cup of tea this time. Actually, that's not true. I did get a cup of tea in recovery. And I did have shaking again, actually, but not as bad.
Yeah.
And the only downside this time was they took them ages to take us round to the ward, because different things kept happening and emergencies kept coming in.
Yeah.
So eventually Joe and my mum left. And I felt fine about it. I think probably because I'd had a baby before. So I was just like, look, she's basically just going to want to feed and be cuddled, and I don't need you to do that. Because I'd had a spinal, I couldn't get out of bed anyway. So so they eventually took us round to the ward. And yeah, the next day I came home. I wanted to be home. Eden wasn't going great, but I think because of what I'd learned the first time around, I knew that staying in hospital any longer probably wasn't going to help with that. The big difference, which I think impacted then what happened later, was that whereas first time round I'd been sent home with quite strong pain relief, this time I got given a packet of ibuprofen.
Right.
And asked if I could buy my own paracetamol, which obviously I've no objection to that. But I was like, is this it? And they were like, yeah. And I'm like, okay. And the following day, the midwife came to see us, and I was like, why do they give different pain relief now? And she said, I don't know. She said, women do not cope as well without it. And I went, I'm not going to lie to you. I've been waiting for you to come because I've really struggled, and it's even worse this time because I've got another child to look after. And we did help and stuff, but he's still there. And I was like, this is so much worse than last time. And she said, oh, I know, ring your doctor. And I had quite a battle with the doctor to get some stronger pain relief. A couple of days to actually get them to agree to it and eventually prescribe it and stuff. And during that time, I felt horrendous.
Oh no.
We really struggled with feeding because everything looked right, and obviously I'd done it before by this point, so I knew what I was looking for. And everything looked right. Like, she didn't look like she wasn't positioned properly or anything like that, and everything hurt so much. But again, the breastfeeding support lady just turned up the day after we got out from hospital at 8 o'clock. And we had her out. She must have been out 3 or 4 times, or one of the team came out 3 or 4 times. And it was so lovely. But I was really struggling, and I just felt horrendous. That's the only way I can describe it. Like, every body part hurt. And then I got to, she was 10 days old, actually. She was 10 days old. It was Halloween. And I was due to be discharged from the midwife. So she came out and said, I'll check your stitches and stuff when I come back at 10 days. And I was like, right, okay. And then the midwife walked in, and she said, how are you? And I went, I feel awful. And she went, you don't look very well. And I said, well, and in the night I'd woken up and I had a big red patch on my left boob, and I was like, it's mastitis. That's why I feel so horrific. it's not just recovering from the birth and being tired and like I've actually got an infection and all that, you know. And she looked at it and she went, yeah, that's definitely it. I'll ring your doctors, I'll get you some antibiotics prescribed, and hopefully, 24 hours, it's amazing how quickly they take effect, sort of thing.
Yeah.
Great. Check my stitches are absolutely fine. Rang the doctors and the doctors were like, no, we can't help you.
Oh my.
And she said, but I'm the community midwife and I'm telling you, I'm looking at the patient right now and she needs antibiotics. All you need to do is prescribe them. No, she'll have to ring 111. So at this point, I'm like almost in tears because when you don't feel well, you just can't be bothered.
Yeah.
And obviously your hormones are like all over.
Mm-hmm.
So she said, I'm so sorry. I'm absolutely mortified. I'm so sorry, but that's what they suggested. And I was like, it's fine. It's not your fault. Like, I've watched you make the phone call. It's not. Mm-hmm. So in the meantime, I contacted my mum, and Joe's parents had actually taken Lucas for the day because I'd been struggling.
Yeah.
And we were both knackered, so they'd taken him for the day anyway. And she said, I'll come through, and even if I just have to sit and hold the baby for a couple of hours so that she'll stay asleep and that you can get some sleep, like both of you. Anyway, I rang her and I said, I rang 111, they've booked us an appointment. Could you, when you come through, will you take us for the appointment and Joe will stay with the baby? Because obviously I didn't want to take a newborn into a hospital. Yeah. Which the out of hours GP appointment was going to be. She said, yeah, no problem. So 3:00 was my appointment. I got there, got straight in, and the on-call GP was like, right, so you think you've got mastitis? Can I see? Yeah, that's fine. Showed him, and he was like, you've definitely got mastitis then, haven't you? And I said, yes. And then he took my temperature, and he said, how do you feel? And I went, well, I feel like I've been hit by a bus, if I'm honest. Mm-hmm. He said, yeah, I can't just prescribe your antibiotics and send you home. And I'm like, oh, okay. So what do I need to do? He said, you need to go and sit out there, and then a nurse will bring you in, and we're going to need to take some bloods and stuff because I'm really worried about you.
Right.
Oh, right. And again, it's a funny thing because I knew I felt horrific, but was that because I just had a baby and I wasn't sleeping very well and I had mastitis and, and so I came back out and my mum had actually dropped us at the door and gone and parked. So I'd already been in and seen the doctor and come back by the time she parked the car and walked in. And she was like, oh, finished. Has he done this? And I said, oh, no, blah, blah, blah. And he'd taken my temperature, and my temperature was something like 38.7, something at that point. So then by the time the nurse practitioner called us in and chatted to us and blah, 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 it was 15 minutes later. She'd taken my temperature, and my temperature was up to 39 point something.
Yeah.
Within 15 minutes. And she said, right, yeah, you're not going home, And I was like, what? She said, yeah, you're not going home, you're going across the corridor and you're getting into that bed. And then a couple of doctors came in and another nurse came in. 2 nurses came in. And I ended up, within the next half hour, I'd had oral morphine, I had fluids going, and I had 2 different types of antibiotics.
Right.
And they were like, yeah, you're what's classed as a potential sepsis case.
Okay.
I was like, but I thought I just had mastitis. And they said, no, I mean, you obviously have got that, but we think there must be some other infection because your temperature's at 40 degrees now. Paracetamol, I'd had paracetamol on a drip as well. And they were like, I had when you've got like the flu or cold or something and you've got a temperature but you feel cold.
Yeah.
So I had a scarf and a cardigan and stuff on, and this poor male nurse was like, I'm really sorry, you're going to have to take that off because you are too hot. Like, you need to take those off. We need to get your temperature down, and the paracetamol will kick in, but I need you to take your layers off because you're just too hot. And I was like, oh. So that happened, and eventually all the various drugs they've given us started to kick in, and I started to feel a bit better. He said, the thing is, your paracetamol is going to wear off and your temperature's going to go back up. And we still don't know what the cause of the infection is. So although we're treating you with 2 different antibiotics, there's still a chance that neither of those could be the right thing. It's unlikely because the 2 that they use cover various things. But we don't know until we know what the source of the infection is. Like, we can't. So I had to be transferred from that hospital, which doesn't have a proper maternity ward,
Right.
to Sunderland Hospital, because obviously they wanted to keep the baby with us. And that was one thing I was quite pleasantly surprised by. They were quite keen. They were like, where's your baby? And I was like, oh, she's with my husband, because I thought I was just coming to pick some antibiotics up, and I thought, why would I bring her into the hospital?
Yeah.
They were like, no, you need to get her in, we want her with you. And they were very, very keen to make sure that the baby stayed with me. And so they transferred me to Sunderland, and that was a bit of a nightmare. By the time we eventually got a room and stuff, I ended up having to send Joanne, my mum, home. And then at like midnight, she came in and said, oh, your temperature seems like it's been fine for a while now, you can go. I said, well, I can't go anywhere. I've got a 10-day-old baby and nowhere to get home because I was just waiting for a room.
Yeah.
That wasn't great. And actually, in the long run, I was right. I stood my ground, because about an hour later, that dose of paracetamol wore off and my temperature shot back up again. And that kind of was the pattern for about 2 days.
Right.
And eventually, it was the Thursday, I think, I got taken into hospital. Yeah. So I was in Thursday night, Friday night, and got home like 6 o'clock Saturday night. And the difference I felt after those couple of days was like unbelievable.
Wow.
And all this time I'd thought feeding hadn't been going very well because the positioning was wrong. We at one point looked into whether or not she might have a tongue tie. And I actually just think that it wasn't the position. I just think every area of my body was so sensitive because of this infection that it wouldn't have mattered what I'd done, it would have been painful. And it just hadn't occurred to us that could be what it was. And I suppose because even when the midwife checked my stitches, there was no sign of an infection or anything there. So that would be typically where you would look for it. Anyway, I felt like 1,000 times better when I got home. And everything was better. Like, Iris was sleeping better. So you wonder how much of whether it was because I felt rubbish or you don't know how much passes on to them, but she seemed more settled. And I'd been home about a week, like the following Friday, I think, and I got a letter from the doctors to say that they'd actually found I had a urine infection, and had suggested a different course of antibiotics again, but they were the same ones I'd had when I'd been pregnant for the group B strep.
Right.
It made me ill. So I rang the doctor and I said, I've got this letter, but please don't make me take them. I'm happy to take something else, but please don't make me take them because I'm only just feeling normal again. I know I reacted badly to them last time, but, do I need to take them? Because I came home on an oral course of 2 different antibiotics as it was. And she said, I tell you what, why don't you just pop a sample in and we'll check, and if the infection's cleared anyway, then we don't need to do it. And that was fine. So I avoided another course of antibiotics. But it was one of those things, like, everybody around us, I'd say midwives, I'd say the breastfeeding support, various people, and I had said, I feel really rubbish, but I just had a baby, and she wasn't sleeping. And yes, after recovering from that, I was still tired, and she's still not a great sleeper now. I'm still tired now, but it's different to feeling fit, healthy, and normal, but a bit tired. To I couldn't stand up without massive effort, and I had no colour in my face or anything like that. And it was worse than giving birth. Having this infection was worse than giving birth, and it's just something I wish I'd known. I wish I'd known that to maybe question it a bit earlier, and maybe it wouldn't have gotten so bad or whatever. Because it was, those first probably up to 2 weeks. I mean, once I was in hospital, that was much better. But definitely those first 10 days, and my mum said she's never in my whole life, and I've had all sorts of illnesses like we all do. She's like, I've never seen you so poorly. You know, you looked, when you walked out of the house to get in the car for me to take you for the appointment, I got a real shock because I just expected, you know, you said that you thought you had mastitis. I didn't expect you to look so unwell. And it was after that, then I was like, oh, feeding actually is okay. And she, a bit like her brother, took a bottle without really too much of an issue. She had to have one bottle when I was in hospital on that occasion, but was only one. She only missed one feed. They were quite keen for us to carry on feeding as well. They were really supportive with that. And then didn't really have a need to give her a bottle, and then she refused, and it's still, she was 1 in October. She's still feeding now, and will. Yeah, she's. I never thought I would feed for this long. I didn't really have a view either way. I've always kind of taken the attitude of, when I've had enough, I've had enough. But what you don't bank on is that they have to agree to that. And she does not want to give up, so we're trying to negotiate that at the moment. It's funny that, you know, she's at nursery 3 days a week all day, and goes all day absolutely fine, loves her food, eats everything they put in front of her, and then as soon as she sees me, straight away she wants to be fed. So, yeah.
And how is your overall transition from 1 to 2 until now? How's that going for you?
It's been okay, you know. My little boy is actually autistic.
Right.
So it was quite difficult, and because he's pre-verbal, so he doesn't have the language, you know, you can't gauge from him necessarily how much he understands from what you're telling him. So we did talk to him about the baby, and, you know, he used to kiss the bump and things like that, and he had kind of, we talked to him about it, but I don't know that he knew how to translate that into what was actually going to happen. And he just sort of, I think for a long time, he just thought she was like another cat.
Right.
I really do. I think he sort of viewed her in the same way that there was this other thing that was here. I don't, you know, that sounds really bad, but honestly, I think that's the case. And he would be fine with her. He's not a particularly jealous child, so that's been helpful. And we were fortunate that we were able to keep him in nursery 3 days a week as well, so he was still getting that time where he was their sole focus. And his routine was maintained and all that kind of thing. And now she's obviously older. She adores him. Like, she's obsessed with him. And he's very, very tolerant of her. You know, if he's sitting eating, and she'll reach across with her hand and just take his food off his plate and things like that. And yeah, but she is very sweet with him. She wants kisses from him. She wants cuddles from him. And he kind of tolerates her. Sometimes he can be a little bit sensitive to noise. Not massively, but he can be a little bit. So sometimes the crying and things can upset him. But we're lucky that he also sleeps through, or he would probably sleep through a bomb going off, to be fair. So we had a couple of nights when she very, very first came home that he woke up in the middle of the night a little bit upset because she'd been crying. But after the first couple of weeks, that's gone, and now he never stirs, doesn't matter how many times she wakes up. And it's just the learning to juggle things that I'd probably forgotten about, like, you know, you go out shopping and you get back to the house and you've got 5 bags in the boot and you've got a baby. And all those kinds of things, and taking them both out together, which we haven't had as much of a chance to do as we would normally, of course. But when we have been able to, it has actually been really nice.
Amazing.
She's a very different nature to him. He was very chilled. But I think probably typical boy in a lot of ways. Very chilled, very laid back. Always liked a lot of cuddles and things. Very affectionate. But generally pretty easygoing. Iris, not so much. It's just, she knows what she wants. And she's got a lot to say about it. And there's no denying what she wants. She's very, very clear. But on the flip side, she is very funny. She's got very, very funny faces. So
Wonderful.
we let her off because she's cute.
Oh.
But yeah, it's generally, we are lucky that we've got a lot of family and stuff around as well. So even though we've had restrictions and things, we have still had support. And Joe's parents were a lot of help when Iris was first born in looking after Lucas for us. So we did get a bit of time to adjust and stuff. And that has been a huge help. But yeah, it's just you find a way, don't you? You just find a way.
Yeah, definitely.
Things like, do we bath them together? Do we bath them separately? You just find what works best.
Exactly.
And you eventually fall into a routine. Of course, then something like COVID comes along and ruins your routine. But we all have that problem. So yeah, I think we've decided we'll keep them. I think it's too late to send them both back.
Yeah, possibly. Might be an issue with that.
I think it's past the returns window right now.
Honestly, I'm so thankful that you've come on today and shared all your experiences. It's honestly been amazing. I'm conscious I've talked for a long time. No, you're all right. It's great to hear your story, and no joke, I'm really grateful for it.
And obviously feel free to edit out whatever is not interesting. It's just because it's hard sometimes, isn't it, when you're talking through things and you're like, and then I forgot to tell you that bit, and and yeah. Feel free to.
No, it's been great. Thank you so much.
No problem. I've really enjoyed doing it, actually.